I'm Nicole Walters. In Section 4, I will be demonstrating basic IV insertion. Before I do anything, I will check my MAR, check patient labs and allergies. I will go into the patient's room, introduce myself, check their name band, check for 2 identifiers, double check allergies. I will ask if they have had any mastectomies, fistulas, or shunts, ask for their dominant arm. I will now go to prepare my supplies. I have prepared some tape. I will prepare 3 milliliters of normal saline. I would discard my blunt cannula that will go in the sharps. I will now attach my needleless device to my tubing. I will unclamp my tubing. I will prime it, reclamp it, put it back in its packaging to maintain sterility. I will now do my hand hygiene once more. I will put on my gloves. I will once again be selecting a vein that is bouncy, resilient, large enough for this insertion, not tender, in their non-dominant arm, that they have had no mastectomies, shunts, or fistulas. I will have explained this to my patient. I am now selecting my vein. I found my vein that's bouncy and resilient, large enough for this insertion, and non-tender. I will be applying my tourniquet 4 to 6 inches above my planned insertion site. I will clean off their insertion site. I will now get my catheter ready. I will check for a radial pulse. I would have checked for a radial pulse to make sure that my tourniquet is not on too tight. I'm going in, I'm applying pressure right below my planned insertion site. I'm going in at a 15-degree angle, bevel up. I've gotten flashback. Now I'm going to go at a 10-degree angle, insert another about 1/8 of an inch, loosen my stylet. I will put the hub the rest of the way in. I will make sure I apply pressure above my site, release my tourniquet. I will attach take out my stylet. It will go in the sharps. I will attach my tubing, being very careful not to pull out my hub. I can now release my pressure. I'm verifying my placement. I am going to aspirate for blood return. I've gotten blood return, which means that I'm in the vein. I will be inserting my saline with a push-pause method. I will now clamp off, maintaining pressure. I will clamp off my tubing, release my needles, my syringe. I will now apply my Tachoderm on the hub, and my Tachoderm will be labeled with the date, time, initial, size, length, and gauge of the needle. I am applying my Tachoderm over my hub. With the outside of remainder of tape, I will label it with my initials, the date, time, size of the needle, length, and now I will apply tape to support my Tachoderm, and I will also secure my tubing. I will now check my 4 Ps, dispose of any sharps. I will document the date, time of insertion, my initials, the size of the needle, that is a peripheral IV, how many attempts, how well the client tolerated it, and I will advise the client to let me know if they have experienced any redness, swelling, or pain. And that's it.